Hello dear students, how are you? I hope you are doing well. So as you know, number of cases of COVID-19 are increasing day by day. So I advise you to wash your hands with soap and water, sanitize your hands, wear mask, maintain social distance, stay home, and if you have fever, cough and shortness of breath, just seek medical attention. So let's come toward our lecture. So do you remember what we have read so far? Do you? So, dear students, so far we have read community, what is community, rural community, urban community. Then we have read health, what is health, health models. Then we have read community health nursing and public health nursing. What is community health nursing? What are the principles of community health nursing? And then we have read the history of community health nursing. So, in today's lecture, we will discuss about the roles of community health nurses. So what are those roles? So here are the 7 roles of community health nurses. Number 1, clinician. Number 2, educator. Number 3, advocate. Number 4, manager. Number 5, collaborator. Number 6, leader. And number 7, researcher. So we'll discuss one by one. So nurse role as a clinician. So clinicians means care provider. So in care provider role, the nurse provide care not only to individuals and families but also communities. So the role of nurse as a clinician is to reduce the disease and discomfort and to reduce the disability and premature death of the peoples of the community. So nurse as a clinician should emphasize on 3 main things. Number 1, holism. Number 2, health promotion. And number 3, skill expansion. So what do you mean by holism? Holism means nurse should provide holistic care. Now what do you mean by holistic care? So holistic care means nurse should not only provide physical patient care to the clients but also emotional, social and spiritual care to the clients as well. So this is the holism that on which clinician nurse as a clinician should emphasize. So number 2, that is health promotion. So nurse should emphasize on the promotion of the health and prevention of illness. So groups and populations, those who are vulnerable to health threats, she should identify those peoples and then she should organize programs to prevent those problems. So here are some example: immunization of preschool children's, family planning, cholesterol screening, prevention of behavioral problem in adolescent. So what are those behavioral problem in adolescent? So what do you know? What are those behavioral problems? Behavioral problems means that in adolescent aggression is very common. They are drinking. So these are all behavioral problems. So uh, this is the responsibility of nurse as a clinician, that she should promote the health of their clients. So number 3, that is expansion of skill. So this is the third thing that a nurse as a clinician should emphasize. So expansion of skills means that she should expand her skills. Not only she should provide physical care, but she should also be good observer. She should have good listening power, communication and counseling as well. So these are some other expanded role of nurse as a clinician. So she should work in collaboration with the consumer and other health professionals, and she should work hard and she should get more knowledge so that she should use epidemiology and biostatistics in her taking care of their patients. So she should also use community organization and development. So what do you mean by community health and development? So community health and development means that there should be a group of people who are coming together to take collective action and generate a specific solution for a certain problem. So this is the community organization and development. So this is another expanded role of a community health nurse. So she should have ability of these. So next, research, then program evaluation, administration and leadership. These are all expanded skill that a nurse as a clinician should have. So number two, nurse role as an educator. So as an educator, as you already know, educators mean she should educate the general public about the safety measures, about the manners that they can promote and maintain their health. So here are some example, like for example the nurses in a community, they can give advice to clients about good diet, about exercise, and they can educate the public about importance of hand washing in current scenario, or about immunization. So the next role of nurse as an advocate. So advocacy means that you are speaking on the behalf of your client. You are fighting for your client or your patient. You are defending your patient. So every patient or client has a right to receive equal treatment. So poor and disadvantaged clients who are frustrated, so it is the duty of nurse that she should become their advocate, and she should resolve their issue. So nurse, and as an advocate, she should have these characteristics. Number one, that is assertiveness. Assertiveness means she should be confident enough. She should be in a position to take risk. She should be a good communicator and negotiator, and she should identify the resources, and she should obtain results as well. So the next role of nurse is as a manager. So as a manager, so as you all people know that nurses also, they're also performing administrative functions as well. So nurse as a manager, when she will work as a manager, she will oversee the client care. When she will oversee the client care, she will call her nurse as a case manager. She will just check that the other nurses, that they are providing good care to the client or patient or not, and she will supervise the ancillary staff. So what do you mean by ancillary staff? Ancillary staff includes all cleaners, porters, etc. So as a manager, they will also run clinics, and they will conduct community need assessment projects, that what are the certain needs of the community peoples. So these are the functions of the manager. She will work as a planner, organizer, leader, controller, and evaluator. So as a planner, she will set goals and direction for the organization or for the project. So as a organizer, she will involve in designing a structure within which people and task functions, so that they can reach the desirable objective. So as a leader, what are the roles of manager? So as a leader, she will persuade and motivate peoples, and she will direct activities, and she will ensure effective two-way communication, and she will resolve conflicts among staffs, and she will coordinate the plan if there is any plan. So as a controller, she will monitor the plan, means she will monitor and this control that program, and she will ensure that it stay on course. Means stay on course means that continuously doing something until it finishes. So as an evaluator, she will compare and judge the performance and outcome against previously set goals and standards. So what are the roles of nurse as a collaborator? Nurses cannot work alone. They work with other peoples, like they work with other clients, they work with other nurses, they work with physicians, teachers, health educators, with social workers, with physical therapists, nutritionists, occupational therapists, psychologists, epidemiologists, and biostatisticians, because they cannot provide care to the clients alone. They need collaboration with other staff members. So nurses role as a leader. So as a leader, community health nurses seeks to initiate change that positively affect the people's health. So community health nurses are being increasingly active in leadership roles, separate from the role that is separate from the role that is I have mentioned in the manager role. So they are working separately as a leader. So they initiate change and positively affect the people's health. For example, as a leader, she will involve working with a team of professionals. She will work with a team of professionals to direct and coordinate some programs. Like, for example, there is a program or campaign to eliminate smoking in public area. So she is the one who will direct and coordinate this project or program. So the next role of nurse is as a researcher. So researcher means to search again and again. So community health nurses engage in systemic investigation. So in systemic investigation, what we do, we collect the data, we analyze the data, and then we solve the problem. The problem that is prevalent in a certain community. So we research, we will search again and again via literature to resolve that issue. So there is an example for you. So home visiting from last research over 15 years supports that the value of intensive home visiting to high risk family is very important. So you should increase your visits to the client, those who are having multiple problems, they are having chronic diseases. So it is the duty of community health nurses to visit home intensively. Regularly, she should visit their homes so that she can see their progress. So, from over 15 years research, they support this idea that intensive home visiting should be there. Now, if you have any questions, you can type below, so I will answer your questions. Thank you so much.